Hello friends, today we are going to discuss here about test series of MRCP 5 MCQs. Let's begin. 65-year-old man had recently retired and over the last month has developed symptoms of trouble concentrating. Retired and after that he developed from last month trouble in concentration. Early morning waking, poor interest of daily activities, lost his retirement pension in the recession. He reported currently suicidal ideation without a specific plan, but these thoughts were not recurrent. He hated his life, cried constantly. He reported that he felt hopeless, unaware of future opportunities or choices in life. He felt stuck and lost. His wife said he was often withdrawn. What is diagnosis? Mania, depression, schizophrenia, conversion disorder, anxiety disorder. So guys, in mania, patient is very happy, highly elevated moods, thinking he is like a god, he can do everything. So mania is not answer. Schizophrenia, there is psychosis, but here is no psychosis. Anxiety disorder, we can't say this is anxiety. This is clear cut a case of depression with suicidal ideation. So hope this is clear. Depression is a state of low mood where patients may feel sad, anxious, hopeless, worthless, may lose interest in activities that once pleasurable, experience loss of appetite or problem concentrating, and may contemplate or attempt suicide. Insomnia, excessive sleeping, fatigue, loss of energy are additional symptoms which may be present. Now, 55-year-old man has had varicose vein repair. He develops a swollen leg 5 days following surgery and an ultrasound of the leg confirmed DVT. On ultrasound DVT we find varicose veins repair already done 5 days before, and again he developed DVT. This is despite him having prophylactic low molecular weight heparin. He is on low molecular weight heparin. His hemoglobin is 11 low. WBC is 13 high. Platelet is low, 45,000 only. Which of the following could have caused the DVT? Behçet's disease, factor V Leiden deficiency, protein C deficiency, immune thrombocytopenic purpura, heparin induced thrombocytopenia. So guys, the single best answer here is heparin induced thrombocytopenia. Why? Low platelet and there is tendency of formation of thrombus. So type 1 heparin induced thrombocytopenia HIT occurs within a few days of heparin and is usually mild. In this case, type 2 heparin induced thrombocytopenia more likely, and this occurs slightly later, 5 and 15 days. It is associated with thrombosis and low platelet count. Alternative anticoagulant should be used, heroidine, danaproid sodium. Now, which part of renal system do thiazides act on? Ascending loop of Henle, descending loop of Henle, proximal convoluted tubule, distal convoluted tubule, and collecting duct. So guys, thiazides are used, act on mainly distal convoluted tubules. Remember, distal convoluted tubules, thiazides block sodium and chloride absorption in the distal tubules. There is usually passive sodium and chloride co-transport. With the block, natriuresis occur. The distal convoluted tubule account 5% of total sodium chloride reabsorption. Now, 35-year-old lady has had treatment with penicillamine for rheumatoid arthritis, penicillamine treatment. She present with weakness and pallor calming. It may be side effect of the drug. Hemoglobin only 5, very low. WBC 2, very low. Platelets very low, 15. INR 1, APTT 27. What is the most likely diagnosis? Acute myeloid leukemia, myelodysplasia, aplastic anemia, folate deficiency, B12 deficiency. Guys, we find here pancytopenia. Pancytopenia find in which condition? Aplastic anemia. Aplastic anemia is congenital by birth or may be acquired by some drugs like penicillamine. So answer is aplastic anemia. There is a pancytopenia due to bone marrow failure. low hemoglobin, low WBC, low platelets. Aplastic anemia can be congenital Fanconi's anemia or acquired due to drugs like benzene compound, insecticide, gold, and penicillamine. Treatment with anti-lymphocytic globulin, cyclosporin, and methylprednisolone. Now, 35-year-old man was in Southeast Asia on holiday backpacking alone. He has returned 5 days ago, having been there is for month. Temperature 38 degrees Celsius, has swollen ankle and elbow. He also complained of purulent penile discharge. Which of the following infections is likely? Retter syndrome, chlamydia, trachomitis, Neisseria, gonorrhea, staph aureus, treponema pallidum. Simple answer. Penile discharge, young male, fever, ankle swollen. Answer is Neisseria gonorrhea. Neisseria gonorrhea, this is typically presentation of gonorrhea. There is penile discharge and knee effusion. The discharge and knee aspirate may grow gram-negative diplococci. Current recommendation treatment is ceftriaxone 125 mg IM single dose, or concurrent treatment for chlamydia should be given for 3 to 6 weeks to include oral tetracycline 500 mg 4 times a day or oral doxy 100 mg twice a day. So guys, hope till here it's clear. Thank you.